Do you need individual therapy? Only you can answer that question. I cannot. Typically, clients come to me because they are dealing with a problem, an issue, something in their life that they wish was different. It might be an overbearing mother in law, it might be anxiety around work, it might be I need help making this choice, making this decision, whatever it is. But you have usually tried two approaches to solving the problem. The first, you've probably been ignoring and avoiding it for a very long time. My husband and I haven't had sex in 7 years. Let me just keep avoiding this issue. Or you have really pursued it and tried all of the things, and it's not getting better either. So you have decided to involve a neutral third party, me, a licensed professional, in your life to help you solve this problem. If we're going to work on this problem together, I like a specific goal. So if you are coming to therapy simply because I want to be happy or I want to feel better, that's not a specific enough goal for us to really be working on together. There needs to be a very specific, measurable item that we want this specific outcome, and what are the steps we can take to get that specific outcome. So the primary treatment modality that I use is called acceptance and commitment therapy. So what information am I getting? How am I responding to this stimuli? Do I like the way I'm responding to the stimuli? Is it helping me move toward who and what I want to be? Or am I freezing? I'm getting stuck. I'm avoiding it. But I know that's the easier choice in the moment, but who and what I want to be long term is not that person. So a lot of ACT is based in action you can take and choices you can make. Another key tenet is mindfulness. So if you work with me, we're going to do breathing exercises. I'm all about a body scan, and really being with yourself and being embodied in yourself so that the body sensations and cues that you get can actually be valuable information to help us make decisions. I want you making well-informed decisions, and your body is a great source of information to be making them. Another treatment modality I use is EMDR, eye movement desensitization and reprocessing. This is used for specifically traumatic memories, moments. They might be from childhood or they might be from adulthood to help you process those things. So you might have had a really difficult birth. Your birth plan was ignored by your provider. You may have experienced sexual assault. You might have experienced severe childhood abuse or the opposite, neglect. And then finally, self-compassion will be a big part of the work we do together as well. So being kind to yourself. I know sometimes we roll our eyes, self-compassion, but most of us are a lot better at giving to others than receiving kindness from others. So how can we help you get a little bit more comfortable being kind to yourself, receiving kindness from others, or asking for kindness from others? Some populations that I work with, right? Specific issues you might be dealing with that I am specifically equipped and trained in or certified to handle. So childhood sexual abuse, for sure. Sexual assault, if you have experienced that, I believe you, and I'm sorry that that happened to you. I have direct experience in emergency rooms, in hospital settings, clinical settings, where a sexual assault just occurred, and we're dealing with that immediate aftermath. And so we can use EMDR or cognitive processing therapy to help you through that. It might be less specific, less around a specific event, and more just a general trauma or neglect that we experienced. You might be struggling with anxiety now, symptoms of depression now. You might be struggling with life after baby, what that looks like, how do I balance parent and my old self, finding that balance, recalibrating your system again to this new normal with this new baby. And then finally, any sexual issues you might be experiencing. Lack of sex drive, pain when we're having sex, erectile dysfunction, or concern around a specific topic. If there is something that you are bad at, we actually need to do that more and really build that muscle and get you stronger at it. We don't avoid it. So sometimes therapy can be thought of as intentional discomfort. It is hard. and the outcomes that you get from doing the hard work are worth it. So if any of this sounds intriguing, familiar, and you are ready to do the work, individual therapy is probably a good option for you right now.